Hi, I'm Larry Dapsis. I'm the entomologist with Cape Cod Cooperative Extension, and in this segment we're going to talk about tick bitology. Yes, how is it we interact with these beasts? Now, in my 7 years here working on Cape Cod, one of the things I've discovered is everybody hates these things with a bloody passion. Biting things like mosquitoes and oceums, they're more annoying. But the prospect of getting a tick bite, nobody enjoys that. Doesn't matter whether you're a young kid. And I work a lot with adults that just some of them unravel fast and far at the prospect of a tick bite. So let's look at how this process occurs. So if we look at our friend the deer tick, they're an ambush predator, okay? They're blind, then they don't move around very far. So they basically wait for dinner to come to them, unlike things like a Lone Star tick that actually look at you and then start rolling your way. So they have this behavior called questing. So here's an adult female deer tick on top of this piece of vegetation, and she's got her front legs stretched up in the air like she's signaling a New England Patriots touchdown. Well, she's not. She's sampling her environment. Her nose is actually on her front legs, and they have an acute sense of smell. And one of the things they can smell is carbon dioxide. So if you're walking through an area and you're breathing regularly, you're changing the concentration of carbon dioxide around you, and they can detect that. They can detect changes in temperature, like body heat, and vibration. So while they can't see you, they know exactly what's going on around them, and with all this information flowing in, that tick will orient towards those stimuli and hope for you to brush up against it. Because at the end of those legs, they have this beautiful little claw, and all you have to do is basically just touch it. It will attach and start climbing and looking for a place maybe to settle down and have some dinner. So let's look at tick hardware, all right? Here's a tick head under a microscope. These things on either side of the tick's head, those are called palps. That's what the tick uses to taste you and see if you taste interesting enough to dine upon. If you are so chosen, it'll take these things here called chelicerae. These are like little scalpel blades with hooks, and what that tick does is it makes an incision, hooks in, and pulls. And so with each repeated motion, kind of like doing the breaststroke, it's driving this beak of a mouth part down deeper and deeper into your skin. And let's look at that under a microscope. Yeah, that's pretty impressive hardware. Not only is it fairly long with respect to body size, but it's got those nice recurved barbs like little fish hooks. So if you were ever trying to remove a tick and you felt a lot of resistance, like you might be ripping out your flesh, it's because you are. That thing is designed to stay there for a while, because from start to finish, that tick might be feeding on you for 4, if not 5 days. And when a tick attaches to you, which can take relatively little time, less than a minute, it doesn't start sucking blood immediately. The first thing a tick does, it injects you with tick spit. And tick spit is absolutely fascinating. Hundreds of biologically active chemicals. And one of the things in tick spit is glue. That thing will actually cement itself in place. It'll secrete things like anticoagulants, keep your blood from clotting, vasodilators, that'll increase the flow of blood to the point of attachment, and things to deaden your nerves, because that tick wants to remain undetected, because it might be feeding 4, if not 5 days. And so it'll go through cycles of sucking blood and spitting and sucking blood and spitting. And when it's done, it'll secrete an enzyme, dissolve that glue, and back itself out, and may have left you with a few microbial presents. So in our habits, it's important to consider and do daily tick checks. And I tell people that using your sight might not be the most efficient way to do a tick check, because those nymph stage of the tick, they're the size of a poppy seed. So your fingertips are probably a lot better way to find these things. So a little bump where you didn't feel one before, but certainly try and use your eyesight. And where should you look for ticks? Well, certainly where clothing becomes restrictive. So behind your knees, your pelvic area, under your arms, around your collar line, even in between your toes. Those are the places you want to focus on. So, but if you are going to rely upon vision, and you should to a certain extent, just how big and small are these different stages of the tick? Well, I tell people in adult stage tick, They're the size of a sesame seed, so fairly large, fairly easy to see. But again, those nymph stage ticks, yeah, the size of a poppy seed. Pretty hard to find, especially at my age, seeing something that tiny. Proper removal tool. Well, it's not this, okay? Big, fat, blunt tweezers, not a very efficient tool. You might just crush that tick. Now, unlike myths that if you crush the tick, you might mainline bacteria that cause Lyme disease right into your bloodstream, doesn't happen. Tick plumbing doesn't work that way, but you just might give yourself a nasty skin infection. The proper tool is really pointy tweezers, and that allows you to get up and just grab that tick by the head as close to your skin as you can get and just gently pull straight up, and that thing will eventually pop. Now, there are some other tools out there, okay? Things like these tick keys, and a lot of these things have these narrow V-shaped groove. And I've seen video of these things, you know, being able to remove ticks. Adult stage ticks, this product seems to be able to work on, but I've seen demonstrations where this is not very efficient on the nymph stage of the tick. And there are some limitations with this type of product. You need a tick that's attached to a fairly flat, broad surface. So if these ticks are in an area that may not be a broad, flat surface, because these ticks can get in some funny places, this wouldn't be a very efficient tool to use. And you see variations on this V-shaped groove in other products. Some are like a tick crowbar, and again, I don't think that's narrow enough to even remove a nymph stage tick. There's a product that came on the market a few years ago called Tickies, and it seems it's a hybrid product. So on one end, you got this V-shaped groove, and it's at an angle, so that actually has more flexibility of where you can remove these ticks on your body. And it's easy to pop up, you know, those adult stage ticks. And on the other end, it's pointy tweezers. So a good two-in-one product. So I tell people record the date, and I think that's important because something like Lyme disease, the symptoms might show up in 3 days, a week, 2 weeks, a month, maybe more than a month. If you record the date and now you're not feeling so good, at least you have a reference point when you start talking to your primary caregiver. I tell people save the tick. That is evidence. And what you can do with this tick is you can send this to the Laboratory of Medical Zoology at UMass Amherst and have it tested to see what pathogens you were potentially exposed to. And we've got a separate segment dedicated just to tick testing. So here's my contact information. I'm always open for business. Look forward to chatting with you on the phone or exchanging emails. And we would like to thank Cape Cod Healthcare for their generous financial support for this project.